Declaro aberta a primeira sessão de trabalho do 11º Fórum Parlamentar do BRICS.
I here open the second session of the 11th BRICS Parliamentary Forum. And I'd like to call on to the panel Mr. Humberto Costa, President of the House and also Parliamentary Coordinator of BRICS in Senate. Ladies and gentlemen, global health is one of the topics we chose for our forum, and we chose not to address only health, but looking at health in the context of an inter-parliamentarian alliance. And alliance is the key word for this work session. Alliance, cooperation, collaboration, joining forces towards a common goal. These are our purposes. In the next sessions, we will address major themes: trade, finance, investment, climate change, artificial intelligence, peace and security. But I do believe that it will be in this session that we will sow the seeds of our most feasible and palpable results, with concrete solutions to the problems faced by our countries in the area of health, especially public health. We are a group of countries that gathers more than half of the planet's population, with purchase power parity. We have major economic potential in addition to biodiversity and so many other topics. We can make a difference in terms of global health, and in order to change this potential into reality. And the Inter-Parliamentary tool is crucial. We do have differences, I do recognize that. We are different nations and diverse nations, but health, disease and life are universal phenomena. The COVID-19 pandemic reminded us of that. Reminded us that the virus can kill anywhere in the world, in the same way that other contagious diseases and cancer and cardiovascular diseases and even, unfortunately, hunger. Because we think, why not join forces towards the health of our countries, of our peoples? We should do that, and thank God we can do that. A good starting point would be to get to know deeply our strengths and to recognize humbly our weaknesses, to map out strengths and weaknesses, to reproduce what is successful, and to create mutual support mechanisms. In Brazil, my country, we have a very large public health system, our SUS. We call it SUS. It faces health in a universal and integral way. So, our Vice President here used to be a Minister of Health in Brazil. Our system endeavors to provide health to all. However, we face difficulties with financing, with staff, and equitable distribution of resources across the country. We have a program for vaccination, immunization, and generic drugs that is very well established. But we still have a long way to go regarding biotechnology. We have very good prevention programs and health promotion programs, but we still struggle to face some contagious diseases, and we face chronic diseases and non-transmissible diseases as well. So we have strengths in some areas to share with other countries, but we also have weaknesses we must face, and I am sure that our struggle will be better if we can inspire ourselves in successful experiences that we have and we can see in our colleagues from BRICS, from our countries from BRICS. So, congratulations for your being here so that we can carry on and fight for better global health to all of us.
Para organizar os trabalhos, esclareço que cada orador
each speaker will be able to speak here for 5 minutes so as to organize our agenda and also to ensure the equality among all of those who speak. So we're going to have a sound alert 1 minute before the time is up. And after that, the microphone will be turned off. I would like to request for everyone to speak slowly so that it will be more precisely translated. And another important announcement. After the list of speakers is concluded, we are going to start the next working session without any breaks. So thank you for your cooperation and thank you for following these rules that are necessary for the smooth running of our sessions.
Concedo a palavra por 5 minutos.
So, for 5 minutes, I'll give the floor to Ms. Inna Sviatenko, Vice President of the High Chamber in Russia.
On behalf of the Federation Council, and I would like to welcome you. We have been witnessing upward momentum in cooperation on healthcare, both globally and among BRICS countries. We have been working in multiple areas spanning public health, telemedicine, and digital technology, managing AI, developing new medications, and we value the attention Brazil's National Congress has been paying to healthcare matters. Over the past years, BRICS have achieved meaningful progress in coordinating the efforts to prevent epidemics, which includes developing new treatments. We expect a specialized vaccine center to play a major role in ensuring that people across BRICS countries can access vaccines, including by accelerating efforts to vaccinate people in developing countries. In this regard, I can mention Russia's proposal to enable BRICS countries to contribute to developing vaccine against tropical infections, including Marburg, Lassa, and Western Nile fevers. Russia has made substantial progress in this domain and our country is ready to share its knowledge and technologies. Russia Research Network for Tuberculosis Research has been proactive in Russia. Russia has initiated efforts within BRICS to devise a comprehensive early warning system to fight transmissible diseases. This system will provide for creating a single mechanism for eliminating breakouts of infectious diseases within BRICS, holding trainings and workshops for medical workers. The expert groups working on developing a technical framework for this comprehensive program includes experts from BRICS countries. BRICS initiatives have a special role to play in terms of promoting cooperation on nuclear medicine for detecting and treating malicious cancers. BRICS established a special working group at Russia's proposal back in 2023 for developing and making innovative radiology medicines and treatments. Russia attaches special importance to developing new cancer treatments and diagnostics tools, including photon and proton therapies. BRICS countries have all the competences they need in the pharmaceutical sector, and by working together, we can achieve faster progress. Promoting medical education is an important aspect of our cooperation. This includes student exchanges, professional training courses for doctors, and undertaking joint projects. It is under Russia's initiative that BRICS created its own medical journal and the Health Coalition, an expert platform. BRICS educational and research institutions can work together to develop their respective national healthcare systems. We have been developing bilateral contacts within BRICS as well. In this regard, Russia presented a mobile diagnostics lab for carrying out medical checkups and ensuring responsive and quality medical services. In 2025, we delivered this mobile lab to Ethiopia as part of an official visit by the Federation Council's delegation to Ethiopia. I know that other countries are also interested in Russia's solutions in this domain. Public health care has always been a major priority for Russia. We have been improving education for medical workers and providing emergency relief. We contribute to developing new treatments and developing digital platforms. We are ready to step up our partnership with BRICS countries along all these tracks. Colleagues, working together on health care within BRICS is developing. So we are stepping up this cooperation. It has a lot of practical importance and is very promising. By exchanging our best practices, and we can introduce cutting-edge medical technology while also improving healthcare across our countries. I'm convinced that this session will make our cooperation even more effective by generating new interesting ideas. I wish you all good health and all the best. Thank you for your attention.
Concedo a palavra ao senhor Pubala.
I'll give the floor to Mr. Pubala Govender, Vice President of the Parliament of South Africa.
Your Excellencies, honorable parliamentarians from the BRICS nations across the world, allow me firstly to offer my thanks and appreciation to the government of Brazil for the excellent preparations for this 11th BRICS Forum. Honorable Chairperson, a few years ago we suffered one of the world's most deadliest and unprecedented pandemics, and that was the COVID-19 pandemic. The COVID-19 virus knew no boundaries and didn't care about the social and economic standing of individuals and societies across the world. It attacked both the developed and developing countries in the same measure. It attacked both the rich and the poor alike. One of the most important lessons that we learned from the COVID-19 ordeal is that we are one global community, which need to unite in conquering contemporary common challenges we face, such as pandemic, scourges of disease, hunger, wars, discrimination, women abuse, and terrorism. COVID-19 did not only result in the loss of millions of lives across the globe, it caused immense damage to the economic and social stability in both developed and developing countries, including the BRICS countries. The COVID-19 further reminded us that in an interconnected and globalized world, no one is safe until everyone is safe. It is for this reason that the Republic of South Africa fully supported the call for the World Trade Organization to waive specific trade-related aspects of intellectual property rights to enable the locally manufacturing of COVID-19 drugs and related vaccines, which was also going to enable speedily access of locally manufactured vaccines and the purchase of those vaccines at reasonable prices across the globe. Honorable Chairperson, the BRICS Parliamentary Alliance for Global Health present us with an opportunity to work together to conquer health common challenges. We must use intra-BRICS cooperation to strengthen preparedness and response to the pandemics, including in vaccine cooperation. As South Africa, we have reached a far advanced stage when it comes to the issue of XDR and MDR TB, which we are prepared to share with the rest of the world. Clearly, we are not ready to proactively respond to such deadly pandemics. The BRICS Parliamentary Alliance for Global Health will help us to use our collective wisdom and medical knowledge to either proactively respond to future pandemics of diseases or to respond better. The strong cooperation and strong commitment amongst BRICS countries will have positive and immense spin-offs in ensuring fair and equitable vaccination as a global public good. It will strengthen our capacity for public health emergencies. Honorable Chairperson, the strong cooperation amongst BRICS nations in the global health seeks to promote equality in global health, particularly in resource-limited regions, by eliminating diseases as public health threats and encouraging the effectiveness of interventions. South Africa supports the progress made towards the establishment of the BRICS Integrated Early Warning System for the prevention of mass infectious diseases in accordance with the international health regulations, health organizations, global outbreak alert, and response networks for identifying future pandemics. Honorable Chairperson, it is worth noting the commendable work that our countries have been doing in meeting annually to discuss health cooperation during the BRICS health ministers' meetings. In this regard, many joint declarations have been issued after meetings such as the Guide for BRICS Health Cooperation and expressing common attitudes. Let us intensify the strength of this cooperation. The BRICS Inter-Parliamentary Alliance for Global Health presents our member states with an opportunity to expand our cooperation and influence to address the global health challenges. It also presents us with an opportunity to tap into the new opportunities that we haven't tapped before. For instance, even though BRICS countries have the world's largest emerging pharmaceutical markets and increasing consumption levels, we are still in a passive position in the global pharmaceutical industry. We should take advantage of this opportunity not only to benefit our citizens, but for the benefit of the global community at large. Many countries have the necessary capacity, skills, and resources to achieve this objective. In this regard, it is vital that we share best practice, share knowledge, share latest technology such as AI to ensure that we benefit the rest of the world. Furthermore, cooperation in global health must be reflected through the adoption of common positions, unified voices, and the collective will in our involvement in the World Health Organization and other international bodies. Honorable Chairperson and honorable members, allow me once again to call for cooperation at an international level so that we work together in the interest of all of humanity. I thank you.
Convido o senhor
Now I invite Mr. Mardani Alisera,
membro do Parlamento da Indonésia.
member of the Parliament of Indonesia.
Bismillahirrahmanirrahim. Honorable chairs, honorable delegates, ladies and gentlemen. It is a great honor for us representing Indonesian House of Representatives to be participated here. This is our first engagement with the BRICS Parliamentary Forum. Thank you for the opportunity to share view on our today's discussion on global health. Global health cooperation is critical for protecting population worldwide from infectious disease risk, which can quickly cross national borders. In our interconnected world, a disease outbreak anywhere can quickly escalate into a global crisis, as demonstrated by the COVID-19 pandemic. Furthermore, global health cooperation also has an important role in resolving health disparities, strengthening healthcare systems, and encouraging equitable access to healthcare resources, all of which contribute to achieving universal health coverage and the broader goal of sustainable development. On that role, Honorable Chair, we welcome the proposal of global partnership to eliminate socially determined disease, SDD, and the neglected tropical disease, NTD, focusing on vulnerable population initiated by Brazil. The elimination of SDD and NTD can help achieve the Sustainable Development Goals, especially goal number 1, no poverty, goal number 2, no hunger, goal number 6, clean water and sanitation, and goal number 10, reduce inequality as well as addressing climate change. Indonesian National Health Insurance aims to provide universal health coverage, has significantly expanded coverage, reaching over 90% of the population, reducing an out-of-pocket healthcare spending and decrease in catastrophic health expenditure rates. In terms of preparedness in strengthening health emergency system to encounter a future pandemic, Indonesia has developed a civil-military cooperation mechanism, which collaborating with the WHO, which play an important and effective role in addressing COVID-19 pandemic. The Indonesian House is also in the process of drafting bill that would facilitate the civil-military cooperation. Delegates, to strengthen BRICS role in global health cooperation, Indonesia encouraged BRICS to reinforce its commitment to global health security through capacity building, medical resource sharing, and creating equal access to vaccine, particularly in the global south. Furthermore, given the United States' current withdrawal from WHO, it is important for BRICS to assume main role in shaping global health governance to make it more inclusive, responsive, and reflective. I thank you very much.
I'll invite Mohammed Rashid, member of the Iranian Parliament.
In the name of God, the compassionate, the merciful, Mr. Chairperson, Excellencies, Honorable Speakers of Parliament, distinguished colleagues, it is a great honor and privilege to address the first working session of the BRICS Parliamentary Forum under the strategic theme Inter-Parliamentary Cooperation of BRICS for Global Health. This meeting is an event in order to strengthen inter-parliamentary cooperation for one of the vital needs of humanity, that is public for all. Ladies and gentlemen, the past decade has been a turbulent period for global health. In today's interconnecting world, health stands alongside peace and security as one of the fundamental pillars of sustainable development and social stability. It actually has social, political, and economic consequences. In today's world, stability is very important, and in a situation where BRICS constitute 40% of the population of the world and a great major portion of the health, we have various capacities for countering challenges for health. Ladies and gentlemen, we in the parliaments have a unique role in strengthening public health systems. Through legislation, oversight, and budgeting, we can develop policies to enable access for health for all citizens. But this national duty should be accompanied with various parliamentary activities through the world. BRICS, as a diversified body with influential effects, has a great responsibility in terms of health. We have to have a common program for the following: expansion of health infrastructure with priority over less privileged areas, strengthening cooperation on research to counter emerging diseases and recurrent diseases, having strong infrastructure against future crises, having vital facilities, and having a roadmap for global health in BRICS based on equal access to treatment services and preparedness against pandemics. Standardization of laws in terms of digital health with observing the privacy and data. Pandemics actually, in that area, we encountered various gaps in terms of distribution of medicines, and it requires human solidarity, which challenged the world conscience. In BRICS, we have to have a new model for health multilateralism, a model which is based on solidarity, justice, free flow of knowledge, and countering domineering policies in the world. This model can be within the BRICS Health Fund or the Alliance of Medical Technologies. Ladies and gentlemen, I do believe that the dialogue between parliaments in BRICS can lead to common legislative frameworks, including in terms of digital health governance, protection of biodata, countering emerging threats, and so on. Ladies and gentlemen, national experiences will be meaningful when they are shared at the international level. Here, we play a great role. Within BRICS, we have to go beyond national activities toward coordinated international activities. We can have a new multilateralism, a role model emanating from human values, local knowledge, and national capabilities. Let's together tap into the capacities of our parliaments in order to adopt strategic decisions and follow fair policies and strengthen parliamentary solidarity toward global health. The future of our nations hinges upon our audacious decisions. Also, I would like to appreciate the Parliament and government of Brazil because of their warm hospitality and for excellent organization of this meeting. Thank you so much.
Convido para fazer uso da palavra o senhor Alberto.
I'd like to invite Mr. Alberto Nunes Betancourt, Member of Parliament of Cuba.
Saludos a la presidencia, a los organizadores y a los participantes en este importante foro. Transmito el agradecimiento de la delegación cubana por la acogida recibida en esta ciudad.
The gratitude and also send the best wishes to the Cuban National Assembly of the People's Powers for the success of the parliamentary meetings. Since its entry into the BRICS as a partner country, Cuba has viewed this as an important opportunity for cooperation and effective relation in which each nation can showcase and contribute its capabilities. Article 72 of the Constitution of the Republic of Cuba states that public health is a fundamental right of all persons and the responsibility of the states. We consider that health is a state of physical, mental, and social well-being. Therefore, it should not be defined only as an absence of diseases or illness. The Cuban health system is based on a public and sole model of service provision with universal coverage free of charge, which provides comprehensive care to the entire population in the countryside and in the city without discrimination of any kind, with primary health care and community and intersectorial participation as its basis. Cuban parliamentarians are permanently working on the health issues. The result of this is the new public health law approved in December 2023. This normative document is deemed to be up-to-date, comprehensive, protective, innovative, ethical, committed to the principles such as human dignity. Furthermore, it's inclusive, respectful, and focused on the most sacred rights, such as the health and life of human beings. Among the new elements, it shows how important it is for us to get together and contribute with all the states. Cuba shared its experience in fighting epidemics and sent 56 medical brigades of the Henry HIV International Contingent to 40 countries and territories, including countries of the European countries. Cuba faced the COVID-19 pandemic amidst a brutal intensification of the economic, commercial, and financial blockade of the United States, aimed at totally throttling our economic trade and access to fuel and international currencies, with special attention of the equity and access to medications, vaccines, and technologies. those that are more essential. This BRICS forum can foment a more solid debate between the countries and scientific areas to contribute to better protection of the population for those associated and also others around the world. We also need to address poverty, the prevalence of an unjust economic system, impact those most
Cuba has reached the state for universal cover from the medical assistance, the prevention and the promotion of health located in the community. To face the challenges that are limited to reach a real sanitary coverage, it's necessary to empower people so they can feel their health as something that belongs to them from their social participation and community participation. To fulfill all the goal of the 2030 agenda to privilege a healthy life and the well-being of everybody, it's necessary the commitment and the political will of the state with this human right that means health. Cuba shows modestly its experience and results applied in more than 60 years and offer humbly all the knowledge of the human capital that was trained under the principle of solidarity and generous delivery for the medical profession and the health of human beings. Thank you very much.
Convido
Now I invite to the floor Mr. Haivansh Naraya Singh, Vice President of the High Chamber of India.
Honorable Chairperson,
Honorable
and distinguished delegates,
and delegados,
address this August forum that plays a pivotal role by fostering inter-parliamentary dialogue and enhancing parliamentary diplomacy to address common challenges of BRICS countries. BRICS is united by broader vision of building a multipolar world order and enhancing cooperation on critical global issues. The expansion of BRICS was done to enable it to serve as a key political and diplomatic forum for coordination among countries of the global south. Post-COVID-19, the Global Health Alliance underscores the urgent need for collective action, not only in strengthening health systems, but also for coordinated responses to emerging health challenges. India has been actively engaged in the BRICS health tracks, contributing to discussions and initiatives that drive the implementation and advancement of BRICS health priorities. India commends Brazil for its steadfast commitment to advancing critical health agendas by building upon the foundations laid during previous BRICS chairs. Honorable Chair, reflecting the spirit of our ancient philosophy, Vasudhaiva Kutumbakam, the world is one family. India, in principle, supports the health priorities, emphasizing the importance of multilateral collaboration to achieve health for all. We recognize that the social determinants of diseases and neglected tropical diseases remain deeply relevant areas of discussion, especially for low and middle income countries. These issues need to be addressed within one health framework while ensuring that such efforts are aligned with the geographic and national priorities of BRICS nations. I am pleased to share that during the 78th World Health Assembly, the WHO officially validated India for eliminating trachoma as a public health problem, a significant milestone of our country. India launched the flagship Ayushman Bharat program, an initiative to reach the objectives of universal health coverage. Under this program, India has established 177,000 Ayushman Arogya Mandirs, health and wellness centers, to deliver a comprehensive range of services for preventive, promotive, curative, rehabilitative, and palliative care. Our Pradhan Mantri Jan Arogya Yojana is the world's largest health assurance program, which covers hospitalization costs up to approximately $6,000 to covering approximately 155 million families and has reduced out-of-pocket health expenditure by 30%. This scheme has now been extended to cover all citizens over 70 years of age. For transforming India into a digitally empowered society, we have implemented the Ayushman Bharat Digital Health Mission, leveraging digital health platforms such as eSanjeevani, Nikshay, NextGen e-Hospital, Integrated Health Information Platform for capturing real-time data and last-mile healthcare delivery. Our eSanjeevani initiative stands as a testament to how technology can create inclusive, scalable, and sustainable healthcare solutions. This initiative has recorded over 359.8 million teleconsultations till March 2025. This is to ensure that citizens in hard-to-reach areas have access to health consultations. India has also launched YouWin, a digital platform to record and track the administration of life-saving vaccines for pregnant women and children, enabling anytime access and anywhere vaccination. Today, it has registered 79 million beneficiaries and administered 292.2 million vaccine doses. We have also introduced the Prime Minister Ayushman Bharat Health Infrastructure Mission to address the critical gap in health infrastructure, disease surveillance, and research. Honorable Chair, India's commitment to advancing maternal and child health has been widely recognized on the global stage. India has reduced under 5 mortality by 70%, neonatal mortality by 61%, and maternal mortality ratio MMR below 70%. This progress positions India well on track to meet the Sustainable Development Goal target of bringing the MMR below 70 well before the 2030 deadline. India is now committed to eliminating diseases such as TB, leprosy, lymphatic filariasis, measles, rubella, and Kala-Azar. Honorable Chair, as the custodians of people's interests, the parliamentarians of BRICS countries play a key role in meeting the objectives of universal health by ensuring that through our shared experiences and collective efforts, we can ensure equitable and safe health for all. Before I conclude, on behalf of India, I thank Brazil for this excellent arrangements and memorable hospitality. Thank you.
Like this? Okay, thank you.
English. It's ready for English. Right? Thank you. I'm speaking. Fala inglês.
Mas, peraí. Vou escutar hindi, né? Vou escutar hindi, vou falar hindi. Tá bom,
Ele fala hindi, eu vou falar inglês. He's going to speak in Hindi and you will speak English.
But I will listen Hindi and then I will...
E ele vai ouvir em Hindi.
Tá, obrigado. हेलो हाँ मैं रेडी हूँ मैं यहाँ पे आ गया हूँ रूम में इंटरप्रेटर रूम में हाँ आ गया हाँ हाँ वो ओम बिरला सर आने वाले हैं अभी मैं रेडी हूँ यहाँ पे मैं ठीक है
Since we ended the list of panelists of this session, I'd like to clarify that we're going to be doing the second session right away in the work of the first 11th Parliamentary Forum of BRICS under the due diligence of Fausto Pinato, Federal Deputy and also Coordinator and the Deputy Chamber and the facing of the Parliament of BRICS. I declare ended this session.